Hey, we talk about being in the top 10% all the time. Why not be number one, first in the world? What Cone Health is when it comes to rolling out a new therapy for its patients. We'll tell you about that story in this month's Code View. It looks freshly pressed and feels like silk, but these linens are Dermatherapy, and Cone Health is the first in the world to bring this antimicrobial fabric to its hospital patients. Bed linens, gowns, and bed pads made from Dermatherapy are cleaner, drier, and smoother than those made from traditional fabrics. Studies done at Moses Cone Hospital and Wesley Long Hospital found fewer bed sores, faster healing of existing sores, and even a shorter length of stay for patients using the materials. The results were so encouraging that linens, bed pads, and gowns made from the material are rolling out to all Cone Health hospitals as well as Penn Nursing Center.
We're not just changing the sheets in our health system. This is actually providing a new therapeutic modality for our patients. So in looking at that, we need to be able to talk to all of our patients and their families about the properties of the linen and why we chose to move to this newer, better product.
Dermatherapy isn't going everywhere, only in hospitals where patients tend to stay for longer periods of time. The final steel beam goes into North Tower May 11th. Employees have had the chance to sign a special white beam, which will be the last beam in the 263,000 square foot addition. The topping out of the building, as it is called, marks the halfway point of the project, which will bring nearly all private rooms and large modern operating rooms to Moses Cone Hospital.
Hard to believe we reached this point. We have made so much progress so rapidly on the North Tower, and you can really see, just looking behind me, the amazing progress that we've made. Only another year from now, we'll be looking at moving in.
North Tower should open in June of next year. Then work begins on renovating 83,000 square feet of existing space inside the hospital. Congratulations to our 2012 Cone Health Employees of the Year. They are Beverly Burt, a patient financial counselor in the executive office of Cone Health Cancer Center. Dixie Doss, a nurse team leader at LeBauer Gastroenterology. Kathy DeCote, a nurse on the post-anesthesia care unit at Women's Hospital. Shane Ellis, an MRI tech in radiology at Annie Penn Hospital. John Haynes III, an EMT in the Urgent Care Center at Moses Cone Hospital. Cynthia Hartis, a counselor on inpatient adult services at Behavioral Health Hospital. Kirsten Knight, a nurse on 5 East at Wesley Long Hospital. Dorothy LaFrosia, a secretary at Moses Cone Surgery Center. And Lisa Matthews, a care management coordinator at MedLink Community Care Management. They were honored April 26th at the Service Awards presentation. If you want an example of employee service, look to Pat Orr works as a coder at Annie Penn Hospital, a place where she has served for 50 years. Orr says one of the biggest changes she's seen has been the introduction of Medicare. But what keeps her at Annie Penn Hospital is what hasn't changed.
When I first came to work here, I got acquainted with everybody that worked in all the different departments. And everybody just sort of knew everybody else. And we just all worked together, and it's been more like a family situation.
Orr was thrilled about using an electric typewriter when she joined Annie Penn Hospital in 1961, and she was very happy to be among the first group to go on Cone Health Link. Select departments and physician practices have been first on the Cone Health Link system, but the next go-live will be different. It involves hospitals. Annie Penn Hospital, Women's Hospital, and Med Center High Point go live on the electronic medical record system July 7th.
The best thing we can do is plan. We've also planned to take care of the staff and the docs. Those weeks ago live, we actually have massage therapists coming in to do chair massages all throughout the hospital during go live. So I think we need to really show the staff that we think of them and the docs, and that we're taking care of them through this process.
Select teams will increase training and other efforts as the go-live day approaches. The Cone Health value of caring for each other includes the word fun. Few things say fun as much as balloons, but remember, don't use latex balloons in Cone Health facilities because of latex allergies.
What we really don't want to do is bring those latex balloons into our environment. Particularly, this is an environment where we have a lot of people who are already immune compromised and have allergies to a variety of substances which can just exacerbate and intensify that.
Shiny Mylar balloons, the type sold in Cone Health gift shops, they're fine. Encourage visitors to bring those. Get those walking shoes laced and ready. Cone Health President and Chief Operating Officer Terry Aiken is this year's Heart Walk Chairman.
I'm actually going to be walking at Heart Walk on May 19th, it's Saturday. We expect beautiful weather. We're trying to make arrangements for that now. And I would invite any member of the Cone Health team who has an interest to talk to their department director about forming a team. And we already have a large number of teams already formed, so I'd encourage you to join one of those teams if you have an interest in walking.
If you want to form a team, contact Aiken or Heart and Vascular Center Vice President Rich Lundy. Speaking of walks, beside the Cone Health Cancer Center at Wesley Long Hospital, you will find the Honor Walk. A grant from the Tannenbaum Sternberger Foundation honored Dr. John Lusk, who was Greensboro's first hematologist-oncologist. Now you can buy a plaque to honor a loved one or a caregiver touched by cancer.
Also give the opportunity not only to recognize an individual, but to tell a story about the individual, to provide a poem or a comment. And the plaques will lead all the way back down the walkway to the labyrinth and be a continuing celebration and honoring of individuals.
You can buy a plaque in memory of your loved one by going to conehealth.com/honor walkway. Money raised from the sale of the plaques here along the Honor Walkway will go to patient support services here at the Cancer Center. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.